Is this being live streamed?
It is, yes, sir. Okay, let's get started, everyone. Thank you for being here. So I'll just open it up with a few comments and introductions. My name is Amber Brown. Right now I'm serving as interim county manager and clerk to the Board of Commissioners here at Stokes County. We have Commissioner Mendenhall here, Commissioner Chandler, Wood, and Cox, along with representation from Health Department Director Tammy Martin, EMS Director Brandon Gentry, Laura Johns here with DRC, along with some of our community paramedics, and also Derek Vickers. He chairs our Substance Use and Treatment Committee. We also appreciate Chief Deputy Eric Holm being here, as well as some of our other faith-based leaders here, and Rick McCraw from King. We appreciate you being here as well. And last but not least, Parenting Path, Derek and Elizabeth from our OSTAT team with the NCACC. We appreciate everyone being here and those who are watching live stream. Just a little bit of information about the opioid settlements. This is a national settlement that local governments across the country work together against some of the largest manufacturers and distributors with opioids. So we actually, settled with them, and the county is getting approximately $7,261,207, and this is across 18 years, the span of 18 years, and it's front-loaded for the first 3. So this is 2 different settlements, and as of right now, Stokes County has about $790,207, but by the end of fiscal year 23-24, we should have $993,003. But like I said, over the total of 18 years, over the span, we should have approximately $7,261,207. That's a little bit about the opioid settlement. The MOA actually governs how all the counties in North Carolina spend the money, including what strategies we have to choose from for how to spend the opioid settlements, and that also requires us to have a public meeting, which is what we're having tonight, just so we can get the kind of some ideas and recommendations from community members, the public, and our local municipalities. With that, I'll turn it over to Derek if he wants to start.
Cool. Hey, what's up, everybody? So, my name's Derek Vickers. I'm going to sit here so I can hopefully get perfect. Cool. So, the Stokes Substance Use Treatment Committee, it was assigned by the Stokes County Commissioners, and on your screen now are the members of the appointed committee. And so these folks are on here because they have experience, whether it is related to substance use prevention or emergency services or some sort of affiliation with that. Law enforcement, there is a recovery person on there, county commissioner, Stokes County Schools, health department, DSS. So there are a lot of sectors represented on the appointed committee. Through the appointed committee, we have been able to come up with different work groups. So these work groups there's a larger committee as a whole, and then each work group falls under the larger committee. And so there are 4 work groups listed on the screen here. We have emergency services, connections to care, community, coalition, and then lived experience. And we came up with these 4 work groups because if you look at the population, if you look at all of Stokes County, it falls under, every person there can fall under something on these work groups. Whether it is someone who has a lived experience, someone who is impacted by substance use disorder, opioid use disorder, or a general population member, or someone who works in law enforcement, emergency services, first responders, they're all represented here. The Emergency Services Subcommittee, like I said, is comprised of individuals, law enforcement, fire rescue, EMS, other first responders. These folks have a specific and nuanced view of substance use disorder when we're talking about being in the field, being in the active line, seeing substance use disorder first person. Connections to care, that is collection of providers and agencies in the county who provide services to folks who are in need, in recovery, whether it is prevention, treatment. It is something that is a specific population, but it is important to include these folks here. We have the Community Coalition building. That is someone who has experience related to community level interactions. When we're talking about community level, that could be anyone birth to 99 that is not directly impacted by substance use disorder, but it is important to include them because they are part of our community. And then we have lived experiences. Lived experiences is important because that is someone who currently is experiencing substance use disorder, opioid use disorder, or it is a loved one who has someone in their circle, someone in their home, someone in their social life that is impacted by substance use disorder or opioid use disorder. So these recommendations come from folks who are experienced. All the folks that we included in the work groups fit all four categories directly. I did want to note that Exhibit B, which is where all of our recommendations came from, as a more broad, diverse approach to impact all of Stokes County, while there is Exhibit A, which is a targeted approach. So we have some recommendations that we're going to go over here shortly in layman's terms, but there are considerations involving Plan A, Plan B. And so we have, that's a little small. Let's see. Okay. The first recommendation breakdown was hiring peer support specialists. These are folks who are persons with lived experience, persons in recovery, persons who have been in the shoes, in the footprint of folks who are going to be served by these funds, served by this money. A peer support specialist is someone who is certified by the state of North Carolina. It is suggested that hiring policies and procedures may need to be adjusted simply because of the background and the current qualifications required for a peer support specialist. The next recommendation was a facilitator coordinator. Either this would be a county personnel person or it would be a collection of folks who are experienced in this field who would be a committee to help determine and define spending procedures. We have also recommended workforce development for prescribers, dispensers, healthcare staff, and frontline workers. Excuse me. This would be facilitated by Northwest Area Health Education Center. These are procedures that all prescribers and dispensers in the county have to have to retain their certification. This would be something that is a training mechanism. The DEA has required that anyone who is a prescriber of opioids receive additional 8 hours additional training, which would fall under this Northwest AHEC training that we would provide to prescribers and frontline staff in the county. And so there's more outlines there about the specific trainings that would take place, whether it was virtual or in person. It includes different mechanisms for either prescribers or dispensers. But you're also talking about advanced practitioners, nurses, clinical staff, and other frontline staff that aren't included as prescribers. Additionally, we have a media communication education campaign. We have recommended a mobile prevention education unit that would be used by first responders to get out into the community, engage community members, provide resources, provide education, and engage folks where they are. One of the main issues with some of the substance use disorder in the county is where we expect folks to come to us, but with the mobile prevention education unit, we would be able to go to them. We have Operation Medicine drop boxes. Those drop boxes are important because you're reducing the supply, you're reducing the access of prescription medication, prescription opioids in the community. You are giving a safe, secure location for folks to bring unused, expired, or no longer needed medications to be disposed of. We have harm reduction education and substance use disorder prevention kiosks. Those are recommended to be made available to the public to provide Narcan, to provide other types of information and resources for anyone who might be impacted by opioid use disorder. We also have indirect services and contracted services included as far as recommendations go. These breakdowns, when they are broken down with monetary numbers, it eats up the funding from the first original opioid settlement funding number, which was a little over $4 million. Amber mentioned how we have $7.2 million for the next 18 years. So there has been an additional sum that has been provided through the North Carolina Memorandum of Agreement, and that is something that would continue to be discussed. But as of right now, these are the recommendations that we have made. Do I have any questions?
I've got one on the Dropbox.
Yes, sir.
I'm in King, and we've got a Dropbox at our police department.
Yes, sir.
And I was talking to Chief Boyette just the other day, and we get twice as much a week there as the other two places in a month.
Yes, sir.
We don't have any place to get rid of them right now.
Yes, sir.
They're stockpiling. We don't know what to do with all of them. So that's a big answer. Big question from us is, where can we get rid of what we got? So anyway.
Thank you, Mayor Pro Tem, Mr. McCraw. I'm not sure how to.
That's it.
Okay.
Good.
Okay. I always call you Rick. Yeah, I always call you Rick. So that is something that's been in discussion. Forsyth County has access to an incinerator, but they only allow that incinerator to be used with Forsyth County. Any collections that come from Forsyth County, whether it's through EMS, whether it's fire and rescue, whether it's police, their incinerator is for their county. There was a facility in Burlington that was used. That is what King PD was able to go dispose of their medications there. That facility is closed down. So the issue of disposing of medications has come up frequently over the last few months. I know that King PD has been diligent in collecting all the medications and keeping track and keeping records. Disposal is an issue. There have been a few different types of, I don't want to say solutions because that answers the problem, but there have been some discussions about a facility in Kentucky that is used by local funeral homes in the county. The issue with that is the cost. Whereas one box of human remains and things that come out of a body when they're processed at the funeral home, that's $50. But when you're talking about collecting, like Rick said, King collects a lot of prescription medications. They've collected, since we've been keeping track, it's over 2 million doses. It's measured by pound. It's not counted anymore. It's measured. And so 1 pound of medications is around 750 pills. What Rick is talking about, where King Police Department is holding on and stockpiling because they can't dispose of it properly, that would cost thousands of dollars. There is a conversation that can be had with the Stokes County Sheriff's Office. The Stokes County Sheriff's Office utilizes an incinerator in Haw River. The issue with that is that Haw River is not accepting new contracts for the materials that need to be disposed of. It would be something where King Police Department and Stokes County Sheriff's Office would have to partner, maybe split the cost of the contract, maybe engage with a memorandum of understanding where the Stokes County Sheriff's Office and the King Police Department would partner together, because it is a county service, that it would be a partnership between the two departments to properly dispose of and get rid of unwanted medications. So those are some high-level conversations that I can't do anything but suggest and recommend. I can't make any decisions about that, but those are some of the conversations we've had. As far as Insight goes, Insight Human Services is my main company. That is my main agency. We have chemical disposal kits. That would take some time. That would take some effort. But we are able to do it that way. So there are a few different options, but Rick has a good point about disposal of medications in the county. Thank you for bringing that up. Hope that answered your question.
Answer the question with no solution.
Yes. Yeah. Well. Yeah. Yes. Yes, sir.
Thank you.
Yes, sir.
Laura, you want to present?
Laura.
All right, good afternoon. I brought my partner up here. I am Laura Bullins. I'm a community paramedic for Stokes County EMS. And this is my partner, Tori Reesby. So we are on your agenda to kind of discuss how we're addressing the epidemic in our county as far as community paramedics. So just a little bit of information about our county. We got to start a program at the beginning of 2019 through EMS to implement community paramedics in the county. Right now, we currently work around 7 to 5:30, Monday through Friday. We have a quick response vehicle. With that being said, we are running boots on the ground for all your overdoses, all of your mental health, substance abuse, as well as high utilizers for EMS. On the back end of our services, like I said, we do use high utilizers. We service those as well for emergency services. We do have a little bit of data to share, but I just wanted to let you guys know exactly how we work. So we work intensively with patients that we encounter, whether it is at point of contact in the event of a 911 call. If they do refuse services, they don't want to be transported to the hospital, we can offer them transportation to alternative destination sites if they meet criteria. Tori and I can transport them to help assist with that. If they do not choose to do that, we offer resources for them. We offer our business card. We offer a cell phone number for contact. So when they are ready to make a choice, we can help them with that. I'm going to let Tori share a little bit of our data as far as our numbers since 2019.
So just going over some of our total numbers as our referrals. So the way we track these are behavioral referrals, overdose and substance abuse, suicide ideations or attempts, EMS Narcan that is provided by EMS, and then POV Narcan that is provided to the patient, the family, or anybody else on scene at the time of that overdose. We also do in-home Narcan trainings with anybody on scene as we leave that Narcan with them. So since our program has been started in 2019, these are just our totals. For behavioral or psychiatric referrals, we've had 1,472. Overdose and substance abuse referrals have been 847. Suicidal ideation or attempts have been 167. There has been 520 doses of EMS Narcan. That's what EMS has given out in the field. We have put 886 boxes, and those are 4 milligram 2-dose boxes into the community since then. And so total referrals for our program has been 1,652. Now that is only tracked through our documentation system. That doesn't include referrals we've had from the public, the sheriff's office, fire departments, or any of our other county stakeholders.
Okay. I did pull some data off of the North Carolina State Center for Health statistics. So it says here for Stokes County, the illicit overdose data, and this is all reported in 2021, there were 28 people in Stokes County who died from an illicit drug overdose during that year. People who had prescribed opioids in 2021 was 7,387 people in our county that were dispensed an opioid prescription. I also tracked overdose emergency room visits in 2022. We had around 90 emergency department visits in Stokes County for a resident of our county. And that does show us on their scoring level. They rate that from lowest all the way to highest. We are rated low on that. That is because a lot of our patients in our county, and I don't have really clarification if that is from our hospital in our county or if that is from an outside hospital. A lot of our patients in our county, they do go to surrounding county hospitals. EMS can transport up to 13 different hospitals. A big number that a lot of people reach out and ask me is overdose deaths in our county. Unfortunately, we as EMS, we cannot track an overdose death. That death has to come from a medical examiner's certificate or a death certificate. But the state says that 33 people in Stokes County died from an overdose in the year of 2021.
How many?
33. Yes. So those numbers do mean a lot. They don't sound big, but for our population in our county, which is around 48,000, it hits home to us. I got to start this program from scratch. We've kind of built it along the way. We've learned ups and downs. We realized over the past 2 years, data is big for us, tracking things, education events. Tori and I, we did 42 public education events last year. That was in high schools and middle schools. That was CPR training, Stop the Bleed training. So we are out here in our communities every day pushing the awareness for this. We got to participate in the overdose awareness event that was held in August at the October Road. We had a great turnout on that. Wendy Odom was there with her agency. She got to do some on-site testing. We pushed resources. So hopefully in the upcoming years, we can make that a bigger event. But we just want to kind of share our information from a county level, what we're seeing, and how we should probably address things. Thank you.
Thank you.
I'll switch it. But next, I'll introduce Elizabeth. She is with the NCACC, the North Carolina Association of County Commissioners. They created an opioid settlement technical assistant team, so it stands for OSTAT if you hear that mentioned. But she's going to do a presentation for us.
Yes.
She's going to get you switched over.
Perfect.
Yes.
I'm going to awkwardly try to stand this way and this way so I can talk to both of y'all. So, hello, I'm Elizabeth Brewington. I'm the manager of health programs for the Opioid Settlement Technical Assistance Team. And the goal of our team is to help improve the health of North Carolina counties and assist in supporting counties in the planning for and utilizing of the opioid settlement funds. So my presentation is really going to be kind of taking a step back and looking broadly at what is the opioid settlements, what is the MOA, and what are the options that, or the menu of options that the MOA provides. So statewide trends, 11 North Carolinians a day die to an unintentional medication or drug overdose. 8 of those were due to opioids. And since from 2000 to 2021, more than 32,000 North Carolinians have lost their life to a drug overdose. Those are stark numbers, but we also know that means those are friends, family members, our communities are greatly impacted. You heard from your community paramedics that overdoses are trending, and the state data confirms that generally overdose deaths in Stokes County are rising. So, the national opioid settlements, you hear about them a lot, and like Amber mentioned earlier, there are a lot of different lawsuits all put together. So, there are bankruptcies, there are different settlements. So, Purdue, Mallinckrodt, Endo are all kind of lumped under the bankruptcies. There's also the manufacturers and the distributors and the pharmacies. So in total, North Carolina is getting $1.5 billion with a B dollars over 18 years. And so the goals and the guiding principles of these funds are to spend money to save lives. We want to use evidence and data to guide spending. We want to invest in the prevention of the root causes of the overdose crisis, focus on equity, and make sure that this is a transparent and accountable process. Hence, we're having this public meeting today. So, North Carolina has a very unique distribution model. Most states do not have this. We are actually the only one in the country that is set up like this, where 85% of the funds are going directly to local governments and only 15% is going to the state. In most other states, the majority is going to the state. So we are very excited that North Carolina is leading the efforts. And like was mentioned earlier, Stokes County will be getting $7.261 million over 18 years. If you're interested in learning about how those funds are coming in, there's the North Carolina Opioid Settlement.org. It is kind of the home for all things NC opioid settlements. And there is a data dashboard where you can see the payment schedule of how these payments will come in, because they will eventually peter out and they are front loaded in the first 3 years, as you can see by that lovely little spike in year 2. Because the Walmarts of the world can afford to pay out all their funds in 1 year, and some of the other smaller distributors and manufacturers need to pay it out over 18. So like was mentioned, the North Carolina Memorandum of Agreement governs how the opioid settlements can be funded. So there's two options, Exhibit A or Exhibit B, also known as Option A and Option B. Exhibit A, Option A, is a list of 12 high-impact evidence-based strategies, and it is strategies that a local government can start spending money on today. They're targeted to try to impact the people closest to the problem, so people who are directly impacted by overdoses right now. Option B, or Exhibit B, is a much longer list of strategies and is more focused, like Derek mentioned, on the community and the people kind of further out from the problem. But in order to unlock Option B, a county or a local government must go through Exhibit C, which is a collaborative strategic planning process. So, the Exhibit C collaborative strategic planning process is a very structured planning process. And we like to use the metaphor as a funnel. It starts with the universe of ideas, all the ideas from the stakeholders, the local community, and we filter down to what are some of the root causes, all the way down to what are the specific strategies we want to invest in. And it is really key to get diverse experts in the room, including people with lived and living experience. So just for fun, here are all the steps of Exhibit C. Like I said, it's a legal document. It's a little tedious at times, but again, it's kind of just to filter through all the different options available. So, Option A, Exhibit A, the 12 high-impact strategies. I'm just going to briefly touch on all of them in the next bit, but here is kind of the list of all 12 in one place. So the first is collaborative strategic planning. We like to say that this is the a la carte strategic planning option, and most counties are doing some sort of this strategic planning option. It's pretty flexible, and a lot of counties are using these collaborative strategic planning funds to hire a coordinator who can oversee the opioid settlements in their county. And it's just to allow counties some flexibility and strategic thinking. The second strategy is evidence-based opioid use disorder treatment, and it is very specifically defined as the American Society of Addiction Medicine's definition of treatment, which is medications for opioid use disorder. The goal of this strategy is to increase medications for opioid use disorder because it's estimated that only 10 to 20% of people with an opioid use disorder are able to access treatment at all. And so the three medications that this strategy is targeting is methadone, buprenorphine, and naltrexone. Strategies 3, 4, and 5 are all focused on recovery support, recovery housing, and employment. So basically, if you remember from psychology class way back in the day, Maslow's hierarchy of need, how are we going to make sure that people's basic needs are met, making sure that they have housing, food, shelter, and then moving up, how can we make sure that they have connections to community, employment, and moving all the way up to self-actualization? So what are ways we can wrap a person starting out in recovery in support and love? So recovery housing is one of those strategies. There's a bunch of different ways that this can look like. It could look like emergency rent, deposits, utility assistance, housing first models. It's basically how can we keep people in housing or keep them in the housing they are already in. Employment support, how can we think about programs that will offer people in recovery jobs and ways to get connected and making sure that they have that level of stability. So one thing to think about is fair chance hiring ordinances. We know that people who use drugs often have a criminal record, and it's hard to find meaningful employment with a criminal record. And so if you have a fair chance hiring ordinance passed, it means that people will have delayed questions regarding a criminal record until the interview process. And so then the applicant has a chance to explain their history. So strategy 6 in the MOA and option A is very narrowly defined into helping children who are already showing signs of struggle. We know that in kids, drug use often shows up first as a mental health concern before they actually start experimenting with drugs. We know that trauma is actually the gateway to drug use. And so this is really looking at how can we wrap those kids up with love and support and also train the adults around them to recognize the signs and symptoms of struggle. So these are programs around adverse childhood experiences and making sure people are aware of those and can connect kids to support. Number 7 is naloxone distribution. So naloxone or Narcan is the overdose reversal medication, and it is making sure that this medication is widely available to everyone. We know that this medication is associated with a 50% drop in overdose fatalities, and so we want to make sure that anyone and everyone can have access to this medication. Number 8 is a post-overdose response team, also known as a quick response team or a rapid response team. Usually community paramedics or EMS are partnered, and it is to visit somebody who has had an overdose within the key hours of 24 to 72 hours, to follow up with resources, link them to care, make sure that they have the supports they need. Number 9 is syringe service programs. So syringe service programs have been legalized in North Carolina since July 11th of 2016. According to the CDC, people who participate in a syringe service program are 5 to 7 times more likely to enter treatment, and they're cost effective, and the North Carolina Department of Health and Human Services has an amazing initiative called the North Carolina Safer Syringe Initiative that trains people on harm reduction programs. I like to think of syringe service programs as community health hubs. At the core, they are handing out people sterile supplies, disposing of needles properly, and training people on naloxone. But they also provide an additional services like case management, hepatitis C treatment, HIV testing, etc. So number 10, 11, and 12 are all focused on justice-involved people. So strategy 10 is a diversion program. So we know that our jails are our most common mental health provider, or mental health treatment provider, I should say. And so these diversion programs are trying to provide an alternative before people are incarcerated. So these are programs focused on pre-arrest, post-arrest, and pre-trial services. The reason this is so important is UNC released a study several years ago, and they just recently updated it, that opioid overdose deaths are 50 times higher within the first 2 weeks of release for people who are coming out of jails and prisons. So that's 50 times higher than the general public, which is just a scary statistic. And they are 18 times more likely to die within the first year after release. So it's really important to connect people to resources and care. Strategy 11 is very similar to strategy 2, but it is targeted to making sure that medications for opioid use disorder are available in our jails and making sure to decrease the likelihood of those overdoses. Another note, in 2022, the U.S. Department of Justice released guidance saying that a jail that does not allow incoming inmates to continue taking their MOUD, medications for opioid use disorder, that was prescribed before their detention, and if they had a blanket policy prohibiting the use of medications for opioid use disorder, that would violate the Americans with Disabilities Act. We just include that here because we want people to know, and that these funds can be going towards paying for medications for opioid use disorder in jails. Number 12, the last one on this list, is reentry programs. So once people are coming out of jails and prisons, what are services that we can provide to connect them back into the community? And making sure that people are connected to housing, employment, health insurance, etc. I include this because we are in reporting season. My team likes to joke that, yes, you have pumpkin spice season, but we also have MOA settlement reporting season. And so all the counties have all these reports that are due, and this is part of that transparency and accountability piece. And eventually, you will be able to find all this information on the local spending dashboards on the ncopioidsettlements.org. One of those current dashboards that are up is the local spending plan dashboard. So this is what other counties have already authorized spending, and so you can see what plans and strategies and what their spending authorizations say they will be investing these funds in. So I know I talked fast and I covered a lot of different things. I'm happy to take questions now or later. Thank you.
Thanks, Elizabeth. Laura, if you wanted to go.
All right. I'm back again. And I'm just going to follow up with kind of what Elizabeth just talked about. As far as the opioid settlement dashboard, that's something that I've been getting on frequently, once, twice a week, sometimes 2 times a day. Just looking to see what's out there. A lot of valuable resource and information. So what I was actually able to collect from their website within this week is what other counties are doing, how they are choosing to spend their funds, what options they chose. So I just did, based on the counties that had reported spending already, I went through comparison-wise due to population size compared to Stokes County. Our population is around 48,000 residents. So some of what I found is there are 3 counties in the same size of us that have chosen Plan A. Out of those Plan A options, they have broken down how they're going to use their services or use their spending. I just kind of like to give you guys some examples, so if you have any questions, just let me know. One of the counties, they are paying it out to their local emergency services. They're applying $50,000 of their settlement money to hire community paramedics. I'm not just saying that because I'm a community paramedic, but that was the first thing on their list. Their community paramedics, they will do a post-overdose response team. They'll pay for sharps disposal. They'll do Narcan trainings. They'll get Narcan out in their community so that it's readily available if needed. That same county, they are spending around $45,000 to do, basically what they're doing is they're paying for transitional housing. So with that, I know in a lot of our work groups, our faith-based communities are big on housing, recovery housing, but this county, what they're doing is they're taking their money allotted to help pay for rent, deposits for treatment. They're even helping cover end-of-life expenses, maybe as far as a funeral or cremation services. So they're working with their local ministries. We do have a big faith-based community in our county. I sit on several boards that include the faith leaders, and they really do. They want to help our county, and they help us in our community paramedic program. If we have a patient that needs a ramp, we can reach out to our church. They help us on that. Some of our other local counties, they are hiring, strategic planning or advisors or counselors to help come up with their best solutions. This other local county that chose Plan A, they are spending $68,000 to hire a community paramedic. I promise this is not repetition. I'm not giving names of counties because I don't want to disclose what they're doing, and I'm not saying that we want to copy what they're doing. But you look at some of the bigger counties next door to us, like Guilford County. I just said I wasn't going to say names, but I did. They are spending a lot of money on strategic planning and hiring a facilitator to handle all of their services. What I did find interesting is 2 counties have reported spending on Plan B. That's generally the idea that our committee is going. They are coastal counties. I'm not going to give names, I promise. But what they have chosen to do is they take small amounts of money. They have a lot of resources in their county, a lot of facilities to help with addiction treatment, substance use, housing. They are taking small amounts of money and supplementing their programs that are already in place. So we maybe even be able to do that within our county for the resources that we do have. So I just thought that was good to know. I would definitely recommend that everybody get on that website, look at that, see what local counties are doing, see where Stokes can fall in as far as that. Any questions?
So Laura, are you seeing where they're spending money on a dedicated person to run the program?
So I am seeing that a lot of counties are hiring facilitators, but I see several counties that have hired out, and it's the question that I have for Elizabeth. They have actually hired out or suggested spending funds for 2 different people. One may be an actual agency, one may be an individual. But if you get on there and you look at their reports, it's not completely detailed. It will say the provider. It'll state that their dates that they're listed for their spending, and then it'll give the total amount for that strategy.
Okay, thanks. And just a comment, I appreciate the stats from earlier.
Absolutely.
It's the overdoses and stuff, and that's something that we need to expand upon to get out to everybody here in Stokes County, not just us sitting in this room.
Thank you. Any other questions?
Thanks, Laura. At this time, we'll go into our comments and questions period from anybody. I guess we'll start with the commissioners. I don't know if any of the commissioners have anything that they would like to share or comment on, or any questions for Elizabeth from the NCACC or our community paramedics.
I'll start.
Yeah.
Laura, can you go back in your mind or your stats in 2021? And I think you give the overdose deaths, suicide attempts, things of that nature. Was 33 a number you gave for
So I gave 43,
33 or 43?
43,
43?
43 and 46 in 2021.
Right.
And that was for suicide attempts or ideations. And that was an EMS generated call from a primary impression. So that was just a ticket that was created by an EMS crew. We had 46 calls in 2021.
Okay. And can I ask a question? One of the things that would be very important to me is the re-entry phase that y'all talked about. You know, you went through a long list of different things, and the last one was re-entry. How are you going to coordinate, or how is the group, or if we hire a facilitator to handle this, coordinator, how are they going to go about creating the re-entry phase where people will know about it, get it out into the public, which will help the county and help the group of people that needs to get back into the re-entry?
Right. Do you want to hit on that, or you want me to?
No, I can do some of it. So reentry would involve folks who are coming out of incarceration.
Right.
So that would involve a collaboration and a partnership with pre-release, post-release, the jail system, and then another person or persons who would help transition them back into society. So when you're talking about reentry, you may be talking about someone who doesn't have a license, doesn't have an ID, needs to start building on some of those requirements, documents, and other required things to get back into society, to get back into everything else. And so that would require collaboration with a few different agencies and a few different partnerships. And so other counties have marketed that. Marketed's the wrong word. A few other counties have established that on how that would take place. Surrey's one of them. I know that Yadkin has a program. Guilford also has some larger counties have some programs already in place, and it would be something where Stokes would have to kind of mirror what they're doing.
And the biggest thing I would say about reentry is we need to really think about the vulnerable patients that we see. The people who are coming out of jails or prisons, they're at a higher rate for an overdose. With that being said, you know, they may be a long-time substance use member of our society, and they don't realize that if they've been incarcerated for 90 days up to a year, they come out. I'm just going to give it how it is, how I see it. They will go out and use the same amount of substance that they use going in. It is chemically cut and formulated different from in the morning to the evening. So, you know, we try to educate, but we need to follow those people. Not only are we setting them out the door and setting them up, you know, with a ride or, you know, a primary care or a medication-assisted treatment, but somebody needs to follow those patients. And that's why I recommend peer support. Peer support seems to be a very hot topic in all of the strategic planning. All of the counties that have reported they have peer support in there somewhere down the line.
How do you do that?
Peer support? Well, so most of the time it is a patient or a person with a lived experience, and they are state certified. We have discussed ways that how we might implement them, and basically a lot of the counties that we're seeing is they are sending peer support out with EMS, or they may send them out with law enforcement. And as that is a civilian in plain clothes. A lot of people are intimidated by someone in uniform. They don't want to speak to us. So to have somebody get down on a ground level with them, look them in the eye and say, hey, I've been down this road with you. I've done this is my struggles. This is where I fell through. It may have taken me 5 times to get back up on my feet. But to have someone with that relatable experience, but basically it is a state certified individual who would be employed by the county.
I guess I'm at, how easy is that to do?
To hire a peer support?
Yes. I mean, in this world when there's a shortage of everything, there people that's willing to do that?
Yes. Like Laura mentioned, most counties are trying to hire peer support and they're placing them in a bunch of different places.
That's what Derek was mentioning, where HR needs to get involved with job descriptions, because obviously if you're going to be peer support, it's probably somebody that's been there and actually done it.
And I have job descriptions from other counties that I'd be happy to send to y'all for what peer support specialists for other counties look like.
Yeah, that'd be good.
Stokes had a peer support specialist that they lost to another county because it was closer to that person's home and they were paid more. So some of it becomes availability and location, and then the other part is finance and money, which is everything, everything that y'all have to decide to do.
So you're just saying the finance, and that's ultimately going to come back to commissioners to make a decision on
Yes, sir.
how much money we want
Yes, sir. Because
to
if
put into that pot.
Yes, sir. Because if a peer support specialist is offered, I'm just spitting a number out. It's not anything concrete. It's nothing specific. But if someone's offered 15 grand more, that's the place I would work. If I was a certified peer support specialist who had the accreditation from the state, that's what it comes down to. And it sucks to say that. I hate to say that. Stinks to say that, but.
And the average salary for North Carolina peer support is around $35,000. I think in our slide we had $50,000, because you really do need to pay that person for their expertise, their experience, and all the training that they have inputted.
So to me, I'm hearing that beside your facilitator, if you hire a coordinator to overlook everything, the next most important person probably would be in the peer support area.
Absolutely.
Is that correct?
I've been in this work for 5 years and I would say yes.
Okay.
Some
You
could
gonna
say it's
need
the
more-
number one. Sorry to interrupt. Excuse me.
You're gonna need more than one, like one in King, one in Wonko type deal.
Two ideally, I think, would be great to start.
Two based in Danbury with the ability to travel across the county because of the broad, the expansive nature of the county. At least two. Yes.
I definitely see counties trying to build out teams of peer support. Some are placing peer support in the health department because that's where most people are coming into contact. Some are putting them with community paramedics, law enforcement. It totally depends.
We would have to decide how we would.
That's the only question I have, Amber. You want to pass it on to Brett?
Oh.
Brad?
Okay, I think
I have a question in regards to peer support. Are there any existing agencies that currently employ somebody in that capacity?
And so,
So who is already doing it?
Well, I did have one in my office, she was peer support, and she was the one we lost her another county. But she was peer support specialist also. And so there are some that are not necessarily offenders, but have had experience and have
Mr. Chandler?
I'll keep my comment short because I normally speak a lot, especially when it comes to this environment. I mean, first of all, I want to thank everybody. I know at times I can be difficult, but I do appreciate everybody's time, and input. Believe it or not, I got the same goal as y'all do. I want to help the opioid crisis. It'd be lovely if we could stop it altogether. It's not reality. But I just want to say that I think it's great that with the opioid settlement, and especially the North Carolina County Commissioners Association, it is fantastic that they've taken the initiative to put all the information into an area that's very, very concise, very easy to navigate for people throughout the counties, throughout the state and all the different counties can go to and see what other counties are actively doing, look at, and eventually it'll be looking at results. I think that's tremendous. And again, for y'all, Laura, to have that initiative to go there, that's when I start to see that, then I think we're starting to all click a little bit to where it's statistics, but in statistics, when you drill down to your home county, it's people. So I really appreciate that, and I think we're on the right track with that mindset. And if we pull all of our county resources together, I think this will really make a difference. Thank you.
I will just note that Commissioner Morris, I believe, is at a conference for the next couple of days for the insurance board he's on. But Commissioner Wood, do you have any comments?
Thank y'all coming. This is a tough subject, but I think we're making headway. I got 2 or 3 questions. The settlements, there's still some that hadn't been settled, correct?
Correct.
Do you have a count of those?
I think it's just Purdue, but I will
Okay,
double check that.
Just that one?
That one's been appealed to the Supreme Court.
Going back to Rick's problem, how do you destroy this stuff?
So, that I was making a note. That question's directed to me, correct? Just want to make sure. So, yes, sir. You can do it a couple different ways. You can dispose of it at home, and as my company distributes kits. Over the last few years, we've done thousands of kits in the county. That's called chemical disposal. And so that is where you take the medication, and I would have my medication either in the bottle it came in. I would have a powder that I pour into it. I have some water I put into it, and I put the lid on it. But that's just for a few pills, okay? Then I have
We're talking about Rick's problem.
Yes, sir. So the incinerator, you have to have an incinerator that goes past a certain temperature threshold, because incinerators, the medications that are synthetic opioids, they have to...
Cremation, we got 3 funeral homes in the county.
Yes, sir. So the funeral home...
Option?
They ship it out. One of Slate Funeral Homes ships it to a place in Kentucky that does disposals of human
That's why
remains.
I don't want to be cremated.
Yes. So you don't want to go to Kentucky. Yeah, absolutely. One of the issues is incinerators are expensive, but the temperature threshold to get high enough to completely melt and disintegrate synthetic opioids, because you're not talking about pills, you're also talking about the capsules, and so there's that plastic and stuff in there which your body breaks down. But if you're talking about an incinerator, it has to have a temperature threshold. And
What about the smoke coming off of it?
So that gets, technically speaking, that gets run through steamer scrubbers. So it goes back up into the atmosphere, and it's nothing because it is...
no more.
Yes, sir. The Stokes County Sheriff's Office uses Haw River, H-A-W. The issue with that is they're not accepting contracts for synthetic opioids or synthetic medications anymore. So anyone who has a contract with them prior to today, which the Stokes County Sheriff's Office does, they're still good. If the King Police Department wanted to get a contract with them today to dispose of, incinerate any items. They could, but it couldn't be any synthetic medications, which include opioids, anything that's a stimulant or anything that's a mood elevator. Does that answer your question?
Another option that you could do, Rick, is have the chief contact the DEA. They have authorized collectors that will come around and take it.
They used to go to Burlington. The State Bureau of Investigators used to have an incinerator in Burlington that was open to law enforcement branches. They stopped doing that. I'm not sure if it got expensive or what the cost was, but that's where I mean the law enforcement agencies in the county used to be able to go there, and it was in Burlington, and you would have to pay for a staff to put it in a vehicle, transport it there, watch them dispose of the evidence, because it is evidence and it is, things that were taken in by the law enforcement agency, and then come back. They stopped doing that. I'm not sure if it was a cost factor, but I assume it was.
I think it was. It was cost.
Incinerators are expensive. They are hundreds of thousands of dollars.
Call the DEA. They have collectors that'll come
You
by
can't
and
just
get it.
throw them in the fire pit on a Saturday night.
You shouldn't. No.
Another way that they told us that you could crush the pills and mix them with dirt. If you had small amounts at your house, crush them, mix them with dirt, just throw them away in dirt. But we're getting stockpiles. I mean, we got 2 million doses.
That's a problem.
We got a big problem, and plus, we're having to keep them under lock and key. I mean, it's a big problem.
And for the community medication take-backs, you have to have a DEA-trained law enforcement officer, and so I think the DEA would have some good ideas.
We've run out of sources. I mean,
Just give them a call.
we're having it stockpiled and just get rid of it.
One more question for you. I think I don't know. Gosh, I'm running out of how many presentations we've been to on this subject. I thought the mobile unit came up that I'm not a fan. I'm not convinced on that. Why? I just don't see how that would be a grand slam.
It's just a tool. It's just a tool in the toolbox, really. It's just a suggestion that came out of the committee to do that because, like Laura said, they go to how many fairs and events?
We did 42 last year, and so we always have a booth, a table set up
Just
to
something
provide
they could
education, provide prevention materials. So I mean, if we're going to an elementary school, you could, if you're going to a community fair,
Say no more. It's your turn.
Well, that's still something we under consideration. I think for as a recommendation and something we can look at the benefit of, because it's like that was brought up, root causes. If you could hit that, you could if you could figure out the root cause and spend some of this money towards trying to do some early intervention and some mental health things with this childhood trauma and stuff, and you can only go to DSS and see these kids that are taken out of the home, and that just puts them at such a higher risk, and that's a place where we could start spending some money that could really impact, and that in turn goes back to the health department and the health board, who's looking at some things that in conjunction with this committee can together recommend to do some things about mental health and the root causes. And that's something big I think we've got to look at. The peer support specialist, in my opinion, is key. I think that's just something that all these counties are scrambling for. Are we going to be able to find good ones? I mean, I think there will be a shortage of them, but I think there'll be more people who will be like, hey, I could do that job. I have lived experience. I didn't know that was a thing, and get certified, and hopefully we will have more people who want to do that role, because that's critical. The health board last night talked about transitional housing, transportation, as big things and peer support specialists, and that came out of that meeting last night. So I think we're all on the same page, really, with that, and we can pull our resources, like you said, and try to come up with a plan. But I appreciate everybody coming and taking time. It means a lot to me personally to know this many people are invested in it and really want to try to find solutions and the best way. And I agree with what Commissioner Chandler said, is North Carolina is one of the few states that actually has this broken down in a way that you can see, you're not just throwing money at something, you're actually looking at what's been tried and what works in other places, and there's some accountability for the money too, and that's a good thing, I think. So that's all I really have.
Is any of this addressed at the elementary school level in the DARE program?
So I'm not affiliated with the DARE program. Insight Human Services does provide youth prevention education at the elementary school level. We offer pre-K bags, which have information about securely storing medications in the home so kids don't access it. We do some bullying programming. We do some self-confidence building. But as far as the DARE program in the elementary school, I can't speak on that. Chief Deputy Cone?
So a couple of years ago, the DARE program kind of changed their focus on how they were doing things. So they hit the gateway drugs, is what they typically hit, the alcohol, the tobacco, and the marijuana still somewhat. But ultimately, out of that 10-week lessons, probably 7 of those focus on making positive choices and consequences to those choices. So at that elementary level, speaking to that 5th grade group, that program is really taking a focus on peer pressure, making the positive choice if you feel pressured, and thinking about a consequence to the choice that you're making. So it hits the gateway drugs, so it really focuses on that decision-making model of trying to get them to think through what could happen if they make the wrong choice. And that's kind of where the DARE program has taken a turn in the last probably about 7 or 8 years, give or take. Thank you.
Mr. McCraw, did you have any other comments or questions? I know a large part of why we had this meeting tonight is for the municipalities to also have a say-so in how the funding's being spent, since y'all didn't get any money directly for this problem.
Well, if I could see anything, I think our King PD and Stokes County Police need to team together to help do that. Also, if any of the monies can be spent, to help the DARE program point out more about the opioids and different things like that. Great program. It really opens up your eyes. When they were talking about 33 people died in Stokes County in 2021, and then only 48,000 residents, then 11 per day in North Carolina. 11 people per day. That's a big number. I don't think people are really aware of that magnitude. Thank you for putting this on.
Absolutely. And I will just make a note that we will be having one of these annually for the course of the opioid funding. So we'll have another one next year as things progress and changes to get feedback and ideas. I don't know if is anybody here from the town of Walnut Cove or the city of Danbury at all. I don't see anybody, but I should make sure we're not missing them. Well, does anybody from the public have any comments or any other questions before we wrap up?
I just want to say one thing, and because I did not get a chance to thank everybody here. I see several different agencies here, and I also see Pastor Cook in the back, and I think the faith organization can play a key role in it. Thank you for coming. And Sure, absolutely.
You can preach if you want to.
There should be a Bible up there somewhere.
Well, we can find one anyway. But no, and all the officials, the different agencies, I see several different agencies here, health department, EMS, paramedics, groups like that. Rick, thanks for coming from City King. Appreciate that. I'm not going to go through what Derek did and say Mayor Pro Tem and all that. I know you as Rick McGraw, so thank you for being here. just everybody that came. Eric from the Sheriff's Department, thank you for being here. All the people in the back, appreciate it. Randy, do you want to say a word before we go?
Yeah, if you don't mind, I think sometimes we just, from back here, or
Oh, come on up. Yeah.
all right. You know, a lot of times we don't know what everybody's doing, and this is a broad problem. I can give just a few minutes of my background. I come from a family full of drugs and alcohol, grandparents, uncles, whole 9 yards. So it touches home very closely. I was sipping suds off of Budweiser when I was 4 years old. I introduced to drugs when I was 13 years old. And so this is just not a job to us, it's a call. It's not a career, it's a call. And I quit drinking alcohol when I found out my wife was pregnant with my son, because I come up through that. I didn't want them experiencing that in their life, so I quit. And about 5, 6 years later, thank the Lord moved in my life and changed my life. And before that, I could care less about what anybody was doing. As long as my family was good, that's all I worried about. The Lord changed my life, and I just want to let everybody know kind of what we're trying to do to help out. Something we definitely need to focus on is the youngins. I don't know how this money is allocated, this, that, and the other, but we look at the addiction problem, but I think we forget about what the impact it's having. About 4 years ago, I took a young man in my home and raised him for a year because his mom was pulling time, a year for selling drugs. His dad pulled a year for selling drugs. And from my understanding, I hadn't reached out to them, but they're having trouble placing kids in Stokes County. And most of them's drug related. And we've got grandparents in Stokes County raising their grandkids. And the ones right now that's supposed to be grandkids in a few years, if something don't happen, it's going to be nobody to raise those youngins. And so but we're going ahead and put a plan in place for the youngins. I got a little boy. Got a little boy at my house today. He'll be 3 years old next, but we've had him 2 years. And he comes from a drug family. Eric knows some of the things that I appreciate him, appreciate his friendship. That little boy's mama died in a drunk driving accident when she was 6 months old. Her dad introduced her to drugs at 12 years old. And her dad overdosed this December, be 3 years ago. So that little boy, I got to know his grandma and grandpa. And so these little youngins, they need somebody in the education part, because a lot of people in the county don't realize that. I'm out in the county because of my work. I got 1,400 some customers in Stokes County, and we pastor, and so we hear about it all. So my big thing is we got to worry about the ones that's overdosing, but we got to worry about the kids that's involved. A little bit about what we're doing. Brother Doss back here is our men's mission director. He spent almost 20 years working juvenile prisons, from Ohio down to Florida out to Mississippi. In those areas, I spent years working in prisons with them. Been in the Morgan and High Rise, Foothills out back, Polk Correction Center, traveled from Ohio down to Florida. So we've had several years of working with troubled people. Brother Doss does a drug program on Tuesday nights that if you can get it in the court system, if somebody, so a lot of people don't realize this, if the judge says you can do probation or you can do a faith-based program, if they volunteer to do a faith-based program, they've got to stick to it to X amount of time, what the judge says. Faith-based is proven to work. You can Google it. Don't take my word for it. Google it. Faith-based works. It changes lives. I can tell you 3 people right now that they went to a faith-based program and they're doing well. So just Google it. 70% better or higher than what others have to offer. I'm just being honest. Don't take my word for it. Look it up. So something else we're working on. We're actually starting a men's mission. We got the building there in Sandy Ridge. We're renovating it, and it's going to be a residential ministry. It'll start out with 3 months just trying to get them on their feet, then go into 6 months up to a year, and the 3 months is try to get them established, and then it's just for men right now. And then try to get them a job. We're looking for folks that got good ethics backgrounds to connect with. I had a guy call me the other day, Lonnie, Brother Doss. He said, don't forget we got jobs over here, 20 some up to almost $30 an hour for people that need a second chance. I don't know about y'all, but I almost asked for a job application, right? But I'm too busy. And so we're working on the men's home over there. We're working on the building, got all that in place, trying to get an education, try to teach them to be men, to get back and look after those youngins. And we want to put them back to their family. A lot of people say get them out from where they're at, and sometimes you need to. But when they get grounded, they go right back where they come from. I believe it's a biblical principle. They go right back where they come from and be a servant to their family and their community that they're from. And so that's what a few of the things that we're working on. So I just wanted, somebody had asked us to come over. Somebody had seen one of y'all, a guy of our church, Todd. He told me. It was you. He said, need to go over there and know what's going on. So I didn't know where to show up at or whatever, but that's what we got going on. And so we just want to be a help and blessing to the community. We have a tent meeting every year that's generated towards, we have all kinds of people come with addictions. It's been going on for 7 years. I'm thinking about somebody right now for 2 years. The family had helped them to the altar up there and prayed for them. And I seen they're working for one of their family members now. They've been clean and they celebrated 2 years being able to work. We got another man that was homeless that showed up there. We put him up, got him in a faith-based program like what we were getting ready to start. And he got back, he got out of that, got with his wife, he's doing well. And so I could go on and on about the faith-based ministry and stuff, and it does need to be incorporated with everything else. And I just believe it's key to all of it. And you said something in a meeting that we was in about some of the people being concerned about that type of program. I've done some research on it. We're modeling after a home in, what's the name of the home? St. Stephen, South Carolina. We're modeling after their home. They've been in place 13 years and has never had a problem in the community. I talked to another guy that we're very familiar with out of Oklahoma, got the same type of ministry. 46 years. I talked to him on the way over here, and has never had a problem in the community out of the men's home. Matter of fact, Brother Crump said that they was highly favored in their community, and people wound up helping with it and excited about what they're doing. And so that's what we're working on. And I hate to take up so much time because Mr. Dawson is going to talk to the North Slope football team about making the right decisions. Thank you.
Thank you.
On that same line that you were just saying,
Yes.
my employer, day job, I work for a window company in Martinsville, Virginia.
Sean Sanders.
There's a place between Martinsville and Danville that's a home like you for men and women, and we employ some of those people.
Sean Sanders just come out of there.
Some of the best employees, because, and one thing about it, they bring them to work, so they're going to show up. And if they mess up, they got to go back into jail. So they're there, and I know we got a young man in the office, he got tattoos all over him. He's got saved, Ricky.
Ricky Sean Sanders. He's the one who introduced me to drugs when I was 13 years old.
He is I mean, tell you,
There it is.
he's working on the phone, he's very appreciative. He's going to be a great success for our company.
Ask him if he knows anything to cook. He'll tell you all about it.
I will.
Depending on the old Ricky. But this is the guy that he's talking about right now. I talked to North Slope's football team about making right decisions. My friends, one of them called me the other day. He's in a correction center, been there 14 years, got 13 more to go. Some of the other guys I've been around running with, I've seen teenagers dead. Matter of fact, last time I seen the guy he's talking about before he went to a mission like we're talking about, he was parked on Lackey Road at a graveyard. And I stopped to talk to him, and he got out of the skin and bones, and I thought I'd get a call any time that he would be dead. I was telling North Slope's football team about making right decisions last year. Brother Dallas, wherever he went, he's got to go. Well, I got top of the hill. This guy he's talking about messaged me and said he's been clean, got in a program, and come to know the Lord. Lord's changed his life. He's got married. He's told me that the Lord blessed him over to work at West Winter Company. And matter of fact, he said when we were redoing the building, he said, remember where I work at, I'd like to help with the windows.
Well, they're going to make him full-time. I mean, he's going to be a full-time employee for us.
So,
And we got women there too. I mean, it's men.
yeah, they work with the women.
It's a great program. I mean, fantastic.
So this is a little what we're trying to do in the county. I've been same farm all my life. I'm not going anywhere. Sandy Ridge is getting worse. Used not to see anybody in Sandy Ridge walking or anything. Now about 2 or 3 times a week. See people coming down the road taking everything they own because of addiction. We was in another meeting. They talking about running a food truck up through Sandy Ridge and Francis Cove. Used to see stuff like that growing up about the little kids over in Africa. Now it's in Stokes County. And it's going to take a whole lot to get it under control. And I believe it starts here. People been aware of it, been concerned, and definitely need faith involved.
Thank you.
Well, if nobody has any other comments or questions, we will wrap it up, I guess, unless, Derek, do you have anything?
No, thanks y'all. Thanks for coming.
Thank you. We appreciate it. We appreciate all of you coming. If you do have more questions or thoughts or even ideas for strategies you'd like to see us work on, just feel free to email one of our community paramedics, Derek, myself, or any of the commissioners, and we'll be happy to get back to you and talk to you about that. Thank y'all.